everybody, welcome to Fertility and Beyond. This is Dr. Vidyalata Atluri, consultant and fertility specialist currently practicing in Hyderabad, India. Today we are going to discuss about what is infertility, how does stress impact infertility, and what can we do to address it. And I'll also be citing an example of a case history that I have dealt with in the past. So basically, infertility is inability to conceive after 1 year of regular unproductive intercourse. So if a couple have been trying for 1 year and failed to conceive, then we call it as infertility. So there could be many reasons for infertility, which we will be discussing in detail in the future videos. But today I'll be confining myself to the topic of stress and infertility. Infertility is like a life crisis. It can be a life crisis to many people across the world. And it can cause extreme emotional turbulence, which can lead to stress, anxiety, and depression. So, although the stress is not a direct contributor of infertility, there is an association between stress and ability to conceive. Those who are having treatments and those who are stressed and those who are not stressed, there is a difference in the success rates. So, how do we address this stress? First of all, give an example of the case history which I have dealt with. About 10 years ago, I have come across this lovely couple who have been trying for 10 years, have had multiple treatment failures. This couple were actually referred from my close family friends. So as soon as they walked into the consultation room, I could see the complete sadness, and they just literally broke down. They were in tears. They weren't in a situation to actually give the history as well. I've just calmed them down, did some counseling, and took the history. And when I just dived deep into the history, I could see that they have gone through a lot of emotional turmoil. The lady, the woman, says that she has been subjected to many insults in the family, etc. Looking at their plight, I have told them, yes, I will treat them, but not straight away. What I've advised them is, first of all, they need to enroll into a program where they will address their stress effectively in the form of breathing exercises, meditation. So I've given them a couple of months to deal with it, and I've guided them to enroll into a program. It's called Art of Living Happiness Program. This is a program where you will be guided into breathing exercises and meditation. So they have enrolled into that program, and they have sincerely practiced meditation and pranayama, what they have learned in that program. And for that 2 months, I've been in constant touch with them, seeing how they're coping. After they have come to me after 2 months, I was really surprised the way they were. They were completely transformed, very calmer, very confident to proceed with the treatment. And from the situation where they were unconsolable 2 months ago, and this time when they walked in, they had a broader smile on their face. They're ready to face the challenge. So at that time, I told them, yes, you're ready to proceed with the treatment. And we did proceed with the treatment. They had a successful pregnancy in the first attempt. More than this, they gave me another surprise. That lady, female partner, when she was into 8 weeks of pregnancy, she called me one morning when I was getting ready for work. She said to me, "Ma'am, are you coming for work?" I said, "Yes." And she said she had a bleeding, just like a period. And her voice was very calm, no panic, nothing. In fact, on the other end, I was in a little bit anxious situation, praying to God, no, God, not for her. Hope everything is okay. So I came to the clinic, and she walked in, and we did a scan. Everything was fine. I was just wonderstruck at the way she has transformed. And I asked her, were you not stressed with the bleeding? And surprisingly, she told me she had a premonition that she will have a bleeding and it will all be okay. And she didn't have any fear or anxiety. And she had a very successful pregnancy, and she gave birth to a lovely female baby. So the moral of the story is, if you address the stress, it will improve your ability to face the challenge, and it will also improve the success rates. As I said before, stress may not be the direct cause of infertility, but many research studies have shown that it can be a contributor in an indirect way. Infertility can be a stressful situation, but it is up to ourselves how we can deal with that stress and make ourselves ready to face the challenge and improve the success rates. So my advice to all the couples in this situation would be, do practice some meditation, some pranayama and exercise, and talk to your loved one, share your feelings. This all will help in elevate your stress levels. I would say before embarking on the treatment, it is very, very important to address the stress levels. I hope this video is of some use for you. I'll see you in my next video. Take care.